Time now for a look at your health. Our topic tonight is concussions and how often they happen in school sports. And it's not just football we're talking about. Here with me now is Dr. Mitchel Goldman from UCSD. Thanks so much for being here.
Always good to be here.
Such an important topic as kids are getting ready to go back to school and parents are adjusting to that. So first of all, really in high school you have to be worried about concussions? How many kids are we talking about?
It's about 62,000 kids a year and 300,000 people in all of sports. So 20% chance that if your child is in a contact sport, they could get a concussion. And it's not just football like we were talking about off camera. It's soccer, it's all kinds of sports where your head is going to become knocked out with another head.
So I would imagine then, because most people I think we're talking about boys, but so it's not just boys. What are some of the other sports?
Especially girls. You know, girls can be pretty aggressive these days as they're getting really great in sports and in soccer, especially when they're doing headbutts or, you know, in other types of sports, in field hockey and rugby, they do have problems as well.
So this is a topic that really came to the forefront last year when NFL players, Junior Seau died, and they started to look at what the effect concussions have on athletes, and of course then that transfers to children. What are the actual symptoms in general for a concussion?
Well, there's a number of different symptoms, especially the ones that we have to look out for are things like temporary loss of consciousness, confusion, amnesia, dizziness, ringing in the ears, and then the really bad ones start to be if you're slurring your speech, if you're nauseated, vomiting. That's what you got to really be on the lookout for.
And those symptoms, is that the same for kids or is it different? And what should parents be looking for?
See, the problem is when infants, and you know, infants can get concussions too, just hitting their head on a table or trying to walk around for the first time and falling down. And when infants get a concussion, it's not as easy because infants can't talk to you. So usually it's if they're more listful, if they're not eating right, if they're not sleeping right, which can occur many times with other symptoms. But if things don't look right with your child after he or she has bumped their head or fallen down or is shaken a little bit, that's when you need to see a physician.
So I think one of the most that most people know about is not to let your child or anybody go to sleep if you suspect they have a concussion. Is that really true or is that a wives' tale?
Well, it's not really true. If someone is suspected of having a concussion, you need to see your physician. And the reason is when the brain has damage to it, it's like a bruise. And if you at that point have to relax the brain, just like if you pulled a muscle, you have to relax a muscle in order to heal. The brain needs time to heal. So with adults and with children, if you have a concussion, it could take weeks, if not months, to be able to get back into sports because your memory's just not there. And especially with young children, you know, even though with older people, maybe in a week you can go back and play football, but with younger kids, you sometimes have to stay out for about a month. You have to give the brain time to heal, and then it'll become normal again.
Okay, Dr. Goldman, thank you so much. Great information, especially for parents going back to school now. We appreciate your time.
But play sports, it's always good, and wear a helmet if you're cycling.
That is probably the most important. Wear a helmet. Walter, we'll send it back to you.